go to our next guest.
Yes, I believe it's Doc.
Standing by.
Doc Underwood.
Dr. Robert Underwood from San Juan Regional Medical Center should be the person on the phone. Good morning.
That is accurate. I am here.
There you go.
Megan, how are you?
We are doing well this morning, Doctor. Thank you for being with us. Thank you for joining us again to maybe give us what we hope is maybe the last update from the hospital with COVID patients and things along that line. I'm hoping that patient numbers haven't been that high the last few weeks, but please correct me if I'm wrong.
They have been trending down over the last couple of weeks, yes. I will say that of the hospitals in the entire state of New Mexico, there have been some days where we have had more COVID patients than any other hospital in the state, which includes University of New Mexico and some of the big hospitals in the Albuquerque area. As of this morning, we have 15 COVID positive patients in our hospital. 3 of them are intubated in our ICU.
So well, that's definitely not the cheeriest of news. But
what a difference from the height of
that
of those
is
numbers,
trending downward. Yeah. And do you guys still have, you converted, I believe, it was either 4 or 5 to a COVID wing. Is that still the case?
So, no, we don't have a COVID dedicated unit anymore. We don't have the need for that. As you said, when the volumes were really, really high, we actually had a full floor and half of another floor that were all converted just for COVID patients, including our ICU. And we turned a unit that is normally an intermediate care unit into another ICU for non-COVID ICU patients. So we are definitely decompressed from that level that we were at, especially looking back to January and February timeframe.
Right. And Dr. Underwood, I want to ask you, even though, our weekly programs are ending about COVID, obviously COVID is still with us. It's not going away. We hope it minimizes, and we don't have to talk about it as much, but I want to make sure the audience understands that the hospital's commitment to treating COVID patients is not ending. Your COVID to Home program, I think, has been very effective in helping folks deal with COVID, and all those efforts will be continuing. Isn't that true?
Yes, sir. That's absolutely true. We'll continue everything that we've been doing up until this time. Hopefully, like you say, on a much lower scale from what we've been doing. But yes, the COVID to Home program, we have monoclonal antibody therapy, and of course we're giving vaccines, and the vaccination is available to anybody who wants it over the age of 12. There's all of those things are ongoing, and we're obviously still available and open to all diagnoses and all care that people need across the entirety of our community, whether it's COVID or not.
Right. And I'm fascinated with this question, especially now after we've had 15 months, and it's kind of a big question, so I feel like apologies if it's springing this on to you because it's somewhat deep, but
we hope you're sitting down.
Yeah. That's not
way to sell it, man.
Don't be that trepidatious. It's kind of a big setup. But the question is, you are in a position of administration and leadership. What are some lessons that you guys have learned over there? This has been again, unprecedented time. So what have we taken away from these 15 months?
No, absolutely. There's lots of lessons that have been learned in terms of our processes that are applicable in and outside of COVID. We had a very robust incident command set up prior to COVID starting. I think we really put that to the test in terms of how we run that on a day-to-day basis, and now we're meeting about twice a week to continue with our process. The ability to be flexible and adaptable, as you know, our COVID numbers have gone up and they've gone down and then they've gone back up again. And our ability to expand and contract our response over that period of time has absolutely been key in our processes. Of course, we learned a lot about respiratory isolation and how to do that en masse. We had respiratory isolation capabilities before, but everything from our hospital engineering team being able to shift airflow from patient rooms so we can isolate whole blocks of rooms so that we're keeping the infection exiting and going through the filtration system rather than potentially having that air, which may be contaminated, going into a room where it wasn't contaminated. I mean, just to be able to do those kinds of things rapidly has been key. We have found that relying on our community has been absolutely huge. The ability to expand, a great example of this was over a weekend, we had to adapt our oxygen delivery system. We've never had so many patients in the hospital at one time that required oxygen. We take it from a liquid form to a gas form. The simple way for people to understand that is boiling water. It's going from a liquid form to a gas form. But oxygen does that at a much lower temperature, and we found that the valve, as the demand went up, was freezing. Again, engineering worked with a lot of our local folks to change the valve system so that the aperture was bigger and it wouldn't freeze up. And so we did that, working with a machine shop right here in town to get the right components in place, and it was really a phenomenal event for us to be able to do that, continue the care of the patient while we did the switch over, and then to share that with the other hospitals within our region. You know, we've worked very, very closely with Shiprock, Northern Navajo Medical Center. We worked with the two hospitals down in Gallup as well, and then the state response in terms of the patient demand and availability of bed capacity. You know, at one time we were literally on calls every morning to look at who had space in their ICU, who didn't have space in their ICU, who needed to transfer patients. I've never seen anything like it. And so to see that actually come into play, those are all lessons that we've learned. And I have to tell you that I think everybody at this organization and across the state, I can text medical directors at almost any hospital within the state of New Mexico now because we were discussing things so frequently about needs. And in fact, I've got a call set up tomorrow with all of our local hospitals at about noon just to talk about demand and bed capacity and staffing capacity. Those things didn't exist before this whole pandemic started.
Wow. I mean, I thought I was super clued into all that was happening, and there were so many things that you just said that I had no idea about, which is why I asked the question, of course. But that's significant, and hopefully we can take some of that stuff with us into future disasters, which will happen, whatever they may be. But Dr. Underwood, thank you so much for your continued work at San Juan Regional Medical Center, the role that you've played in these past 15 months with this thing that has tore through our town. And so our appreciation to you and all of your colleagues.
Thank you. It has been yeoman's work, for no doubt about it. The folks and the team here at the hospital have stepped up in times that were very, very challenging. We've lost some of our caregivers here to COVID, and the fact that people keep coming in, keep doing the work, and it hasn't been easy emotionally, physically. I could not be more proud of the caregivers at this facility, from physicians to nurses, respiratory therapists, to housekeeping, to food services, just across the board. I do not know anybody at this hospital who hasn't been affected in some way and has been part of the solution to make us successful.
Well, we appreciate all of their efforts and yours, and of course, all of you who have always been available to talk to us when we've asked and provide information to our audiences. We certainly appreciate that too, Dr. Underwood, so thank you.
Yeah, likewise, and thank you for supporting us. To all of the KSJE and certainly to you, Scott, and to Megan. You have been a great resource for our community to get information out about what was going on with the pandemic, so thank you.
You're very welcome. It's been our great pleasure to do this program, and as we said, COVID's not going away, and neither are we, just this weekly show. So we'll be back as warranted. But stay well, Dr. Underwood, and we'll figure out another reason to talk to you for sure. Don't worry about that.
I appreciate that.
All right, very good.